What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID or any other virus, I hope you have no long-term issues with a full and speedy recovery and no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, January 22nd, 2024. We do have quite a few things to get through today. We got some news stories, some stuff from Twitter. We got new data just in from Walgreens. We also want to take a look at a few more wastewater sites today because we didn't get through enough of them yesterday, and there's a few states that I haven't looked at enough. I know you guys are asking, can I do such and such state? You're correct. I need to include more states aside from going to the same states day after day after day. We need to include more states. We need to be more fair. If you're new to my channel, give this video a thumbs up and subscribe down below because this is where we do the work that the media has stopped doing because, well, the media doesn't feel the pandemic can bring them ratings. Therefore, they don't talk about it much. But meanwhile, there's a lot of people that want to know about it, and there's more and more people as the days go on that are getting long COVID, and they're searching for answers. I think after a while, if enough people get long COVID, unfortunately, yeah, it is going to bring ratings to the media because they're going to be like, why aren't you saying anything? There's already a ton of people saying that right now, that there's just not enough coverage, so that's where I come into play. Alrighty, first off today, Donald Trump's trial suddenly halted because of COVID. You know, the E. Jean Carroll trial that's going on. Well, it's been suddenly halted because apparently one, maybe even two people I've either had contact with COVID or have come down with COVID. Nonetheless, they are sick at this time, and the trial is on halt, at least for a day at this time. This is still an evolving story, so we'll have to revisit this and see what comes of it. All right, then we come to this. I thought this was interesting. We're just going to read a headline here. There's a lot of news today. Cats and dogs more susceptible to human illnesses than scientists thought. What does that mean? Well, basically, when you get sick in your house, apparently there are more cases. If you get sick in your house and you happen to have pets, apparently there are more cases of this leading to the pets getting sick than we earlier thought. So if you have a cat or dog, maybe the cat or dog ends up contracting whatever virus you have brought into their habitat in your house. Moving on to this. This is something we're going to spend a couple minutes on this because this is very important. I thought maybe we'd do a video of its own, but I decided no. Let's include it in the pandemic update. Canadian study finds COVID measures were effective in reducing cases, hospitalizations, and mortality rate. Very interesting. So if you recall, at the beginning of the pandemic, mask. Now, though be it, they weren't telling you what type of mask. Cloth, face coverings, surgical masks, but let's just repeat that. These masks right here are much more effective. And basically, at the beginning of the pandemic, all the measures that were taken, stay at home unless you have to go out, essential workers, all that business, guess what? It actually did its job in reducing cases, hospitalizations, and even deaths. Now, at the time, deaths were rather high because we didn't have very many treatments. We didn't know much about the virus. We know more now, but there is still a ton that we do not know, and with each and every new variant, our treatments respond differently to those variants. If it was so effective in the beginning of the pandemic, why did we bother stopping? Well, I'll tell you why. There's no benefit for the economy doing these measures. There's no benefit whatsoever. It slows down the economy, and they are not making money. The rich people of the world are not making money. Therefore, they're the ones in power, and they're the ones that are saying, okay, maybe it worked, but guess what? We got to keep the economy rolling. We got to keep making that money. Yeah, money over the health and well-being of the citizens. It's utterly ridiculous when meanwhile we have measures such as masking and other things that work, and now we do have a study that backs this and confirms that it works. But yet no one is interested in going back to those measures. They would rather everyone just get infected, which is just totally ludicrous. We need to slow down the spread. We need to stop these new variants because each variant is capable of a different thing. And at some point or another, a more severe variant's going to come. There's already some indications that JN.1 may have been more severe. Can't confirm or deny that because there's not enough studies out yet. We'll find out soon enough what the verdict is on whether JN.1 is less severe or more severe. We'll find out. But the point being made here is we had measures that worked in the early days. We let them go, and now we basically said let it rip, while knowing that those measures did work, and now there are studies out there, or this study, that says, yes, it did actually work. Moving on. Unbelievable. Check this out. Yeah, more nonsense. Speaking about things that just worked, well, guess what? Let's just relax it even more. In the state of Oregon, they did. Check out this nonsense in Oregon. You do not need to report your positive test result to Oregon Health Authority, OHA. If you have COVID-19, you do not need to isolate for a set number of days. However, you can still get others sick. Well, if you can still get others sick, why not have them isolate? This is coming straight from the health department in Oregon. This is their website right here. If you test positive, you do not need to report your positive test result to OHA. Oh, let's suppress those numbers. We don't want those numbers to get too high. That would insinuate we're not doing our job. And that would insinuate that telling people not to isolate is not working. Well, hello. Guess what we do have? We have the lovely tool called Wastewater, which we do look at frequently on this channel. We can tell whether or not your level's high. Oh, wait. We're talking about Oregon here, right? Hang on. Let's just skip over this for a second. Let's zoom this out. I want to show you something with Oregon. I think this is still the case. Yeah, it is. Oregon. Where's your wastewater? We can't even see in wastewater if your levels are high or low. Here's a wastewater site, but when's the last time this is updated? Oh, no data at all. Hasn't updated in a long time. Yeah. So going back to what we were just talking about here, yeah, Oregon is trying to cover up this pandemic as much as possible. Totally ridiculous. On we go, moving on. Here's this now. This is coming from David Christopher. He is a wonderful person. God bless David Christopher. I mean, he constantly posts great stuff. He always is right on top of what's going on at his hospital in Ohio. I think he's in Northeast Ohio. He is always on top of it and reporting what he is seeing happening, what's going on in his emergency room. I mean, this is just a wonderful person. Here's what he put. I want you to see this. This was January 22nd. That's today at 9:27 a.m. We're so low on COVID PCR kits in my hospital because supply chain manufacturing back ordered so much testing that we have to pick and choose who we test according to symptoms and other factors. Hopefully getting shipment tomorrow, but who knows? But we have the tools, right? You know, we're constantly told we have the tools. Meanwhile, this hospital doesn't have enough testing. They have to pick and choose who gets tested. And if I had to guess, this is probably going on at a lot of different hospitals across the country. Totally ridiculous, right? All right, moving on. Then we come to this. All right, we have some weekly numbers. Yeah, let's do the weekly numbers now. And then there is a survey I took yesterday that I do want you to see the results of that. First off, influenza. Estimated 2 million new cases. Average is now up to 2.6 million, so it's up a little bit. But the actual cases, they are starting to fall a little bit. Hospital admissions, 30,000. New deaths, another 1,600. Remember that number. Let's enter that in here. 1,600. Okay? Because we're going to be taking a look at some COVID data in a little bit as well. The average number of deaths, they went up a little bit. 1,950 to 106. Seasonal flu remains high in parts of the country, especially in southwest, southeast, and eastern region. Flu is down in the northern states, except in North Dakota. New cases are down from last week, but the most recent data shows a new increase in some areas. Yes, it's still increasing in some areas. All right, continuing on. Let's get over to those COVID numbers. Taking a look at the BNO weekly update for COVID, new cases, they're still high. They're still really high, and this is just an underestimate because so many people don't test or report their at-home test. Weekly U.S. COVID update. New cases, 330,540. The average is 348,690. That's up by 7,351. It says 50 out of 50 states reporting. They will explain down below. They always do what that means because not all 50 states do actually report. In hospital, 27,879. That's actually down by 1,406. In the ICU, 2,733. That's down by 91. All right, new deaths. Remember, influenza, there were 1,600 deaths. New COVID deaths, 2,381. Let's add that number together and see what we come up with here. And we come up with another 3,981 deaths between just COVID and influenza. Doesn't include RSV and any other miscellaneous respiratory virus that is causing deaths. So if you added it all up, it's probably yet again over 4,000. So yes, we are still doing far too many deaths each week in the United States. All right, the breakdown for this week's case numbers. Reports are actually from 22 states. Estimates from 28 states. Yeah, 28 states that didn't actually give a report, so they had to estimate the numbers. COVID cases remain elevated across the U.S., but we have likely passed the peak of this winter's wave, although the impact, deaths, and hospitalizations will continue for weeks. And take a look at this. During the past week, roughly 33,000 Americans were hospitalized with COVID, down 9% from last week. Nearly 28,000 people are currently hospitalized. This is the third week in a row with more than 2,000 new deaths, or 6,643 deaths combined. This is also the 19th week in a row with more than 1,000 new deaths, or more than 30,000 during the same period. So we are still doing far too many deaths. And once again, 3,981 deaths combined between COVID and flu. All right, moving on. Late last night, I decided, you know what? Let's take a poll. I'm curious, how many people actually feel safe going out into the public right now? So I said, let's do this. Just a simple question about this huge wave of illness we are in. Do you feel safe going out in the public right now? So far, and let's refresh this, 964 votes. There's still 10 hours left. Almost 1,000 votes. It will probably go over 1,000. 7.5% said yes. So the trolls did not come out in this one. 92.5% said they do not feel safe going out in the public right now. Again, 92.5%. That, my friends, out of 964 votes, that's quite a few people, and that number will likely go up higher. Like I said, it'll probably go over 1,000 people. And there has been several different comments on here. Here's one. I haven't felt safe in public since Biden told everyone to rip off their mask. And that seems to be a theme, not just on this post, but I have heard many people say it again and again since the great unmasking. They have not felt safe to go out in the public. All right. I was alerted to this yesterday, or shown this yesterday on Twitter. I thank the person who did that. I don't remember their username, but this is for the city of Houston, Texas. Take a look at this. This is their wastewater. Yes, we can actually look at their wastewater. And you can see here, there's up arrows, there's down arrows, there's also these flat arrows. And the one you probably see the most of is flat arrows. There's quite a few of them. Now, this is as of January 8th. It's a little bit behind, but I figured, what the heck? Let's look at it anyhow. So at that time, the northeast side of Houston, you did have one area that was actually dropping. And all across Houston, you had many areas that were flat, but you also had some areas that were still rising. Yes, take a look at that. There are some areas here that still have rising levels of COVID being detected in wastewater. All right, let's take a look at today's air quality report and see what's going on around the country. I have to refresh this. You might see some bad air qualities or some moderate air qualities in the central region. That's because there is an ongoing storm system there. There is also some moderate air quality in the east. Not too concerned about that. What I am concerned about is what is going on in the Pacific Northwest. You can see there is a ton of red, orange, and yellow, which is not a good thing. If you want to learn more about climate and weather, I do have a channel where I do just that. It's Climate Data Report. That's my other channel. We already posted today's climate update. We talked about a potential flooding event that's going to be unfolding in the U.S., and we talked about another storm that is going to impact portions of Europe, Ireland and UK specifically. So yeah, check that out. I will leave a link to today's video in the description down below, or I will try and leave that in like a little bumper down below. All right, taking a look now, we got to take a look at a few wastewater sites before we get to the Walgreens updates. There's a couple states in particular that I want to take a look at. One being Maryland, and let's take a look at the Hollywood, Maryland wastewater site. We can see here, COVID there, it was rising. Now it's recently started to level off on the most recent update. Still high RSV, though it's dropping. Influenza is rising. HMPV is rising. Norovirus at this time is high but dropping ever so slightly, and none of the other viruses are an issue at this time. More on Maryland when we get over to Walgreens in just a moment. We also want to take a look at what's going on in Kansas today. Let's see if we can't get closer to Topeka. Well, here's Lawrence, Kansas. What's the population of this site? 80,000 population. High levels of COVID are being detected. They were dropping. Now they've leveled off somewhat. RSV, most recent update, is rising a little bit again. And influenza is seeing a dramatic turnaround. It was dropping, and now it is starting to rise again. So that's not a good thing. HMPV is rising. Norovirus. Wow, norovirus is really rising. This is almost similar to what we saw in Arkansas. Not quite as extreme, though. And hepatitis. There's some detections of that. And there are no detections of Mpox at this time. All right, continuing on now. We do want to take a look at yet another wastewater site. Let's come down here to see what's going on in the Atlanta metro area. Let's go to the South River wastewater facility. COVID at this time, it is flat. It's rising ever so slightly. Not terribly concerning, though. And RSV, most recent update shows it may be starting to drop. Influenza is starting to drop. Norovirus has been rising. It's leveled off a little bit now, and no hepatitis A, but there was an Mpox detection back on December 3rd. All right, moving on now. We have to get to the all-important Walgreens update, which did come in today. The national positivity rate is 28.7%. Prior week is 27.5%. It went up 1.2%. The reason being for that is because there is a significant drop in testing. The holidays are over. There's not a lot of reasons for people to run out and say, oh, I need to get tested. It's not a big season now of people going to visit one another. So that's why testing went from 22,320 to, yeah, it's way down. You get the point. All right, we do want to take a look at some states now. Let's start off with Kansas. Kansas is currently at 27.8%, down 1.1% from 28.9%. Testing is also significantly down. We are seeing a significant rise in positivity in Maryland, 29.5% versus 22.5%, and that is up by 7%. And now let's come out here and take a look at Arizona. Arizona is at 25.5%, up 0.8% from 24.7%. New York State. New York State is at 45.7%, down 2.3% from the prior week's 48%. And New York State, we do know, is dropping because look at testing. 875 tests versus 1,132. So this is a legitimate drop. Oregon, we talked about this at the beginning of today's video. Oregon, your positivity rate's rising, and you're not really getting tested all that much. 28.1% versus 21.6%. That's a difference of up 6.5%. Total tests, 32 versus 74. So testing's down, but again, that positivity rate is upward. Let's do a couple more states. New Mexico, 25.8%. That's an increase of 5.1% from 20.7%. Testing is down. And finally, let's take a look at Illinois. 26.2% versus 29.9%. That's down 3.7%. We'll take a look at some more states later on, maybe tomorrow. The latest variant that is dominating, as you know, is JN.1, which is at 85.7%. All right, coming over here, I wanted to show you Philadelphia's EMS call volume. Again, still no update. No matter how many times I refresh this, there's just no update. So we suspect the person who does the update did get sick, or something happened, or maybe they're going to see some. I don't know. But there's nothing. They're not even tweeting in general. All right, Montgomery County, Pennsylvania, 19 total EMS calls, and ooh, I'm seeing some bad ones. Multiple cardiac emergencies, multiple respiratory emergencies. I'm seeing cardiac arrest. Yeah, a lot of cardiac calls. And let's take a look now at what is going on over in Chester County, Pennsylvania. Wow, really busy here. Sick person, sick person, three sick person calls, multiple respiratory difficulty calls, heart problems. Yeah, there's just way too many calls ongoing in these areas right now. New Jersey, 64 out of 70 hospitals reporting 1,074 hospitalizations. We know that number would be a little bit higher if all hospitals reported. 43 people on a ventilator. And Indy ICU, 133. Discharges at this time, 157. New York State cases are 2,935 new cases. And when we take a look at hospitalizations in New York State, there's 2,732 of them. Alrighty, folks, that was a long, lengthy pandemic update today, wasn't it? But guess what? We had to get through a lot of things, and I am sure you learned a few things today. If you did, give this video a thumbs up. If you want to see more content like this, subscribe to my channel down below. And of course, share these videos with anyone who needs to see them. And remember, we do have that other channel, Climate Data Report. We posted a video there today. Alrighty, folks, I will see you all again next time. Until I see you again next time, stay safe, leave your comments down below, and take care. Have a great Monday afternoon, and thanks for watching.